Hey, good morning, everyone, and welcome. This is Adam Sotak. I'm the Public Engagement Director for NC Child. Want to thank all of you for joining us for this January 29th weekly legislative update. Looking forward to getting some really great information for you all today. Michele Rivest, who is the director of the North Carolina Early Education Coalition, is going to be sharing lots of good insights related to advocacy in the early education realm this year. And we're also going to be hearing from Ashley Perkinson, who is our NC Child lobbyist. Before we start, though, I want to make a quick announcement. I am going to run through the agenda again here in just a moment, but before I do, I've got some quick instructions. The session today is completely bilingual in English and Spanish. We have a live interpreter on the line, so everyone is going to need to choose either the Spanish or English channel to hear the audio. If you do not choose an audio channel, you will not be able to hear the presenters. To choose a channel, look for the little image of a globe and the word interpretation as highlighted on your screen there. It's on the bottom of the Zoom screen. Click that and choose Spanish or English. If you choose the Spanish channel, you'll hear the interpreter speaking in Spanish. You'll also be able to hear the English language presenters at a low volume in the background. If you do not want to hear the English at all in the background, you can click the globe icon again and choose mute original audio. Presenters, this is for you. Please be sure to speak as slowly and clearly as you can and take some breaks while you're talking, and that will make our interpreter's job much easier. For everyone, we have a lot of participants on this webinar, so we're going to keep everyone on mute to preserve audio quality. But feel free at any time to put any questions or comments you have into the chat box, and Fawn will try to relay those, and we'll try to get those asked during the presentations. Finally, the session is being recorded and the video will be available later today in both English and Spanish, and you'll get a follow-up email that has the video links and all the materials from today's meeting. So let's go ahead and get started. Unless, Fawn, you have anything else to add before we jump into things.
Nope, nothing else to add. Good morning, everybody. Glad you're here.
All right, wonderful. Once again, welcome. And here's a look at our agenda. Once again, we're going to get right into discussion with Michele Rivest, who's going to be sharing some really important advocacy information with us. What's kind of on the table here in the state of North Carolina when we're looking at early education. And I'm really looking forward to hearing more and learning more from Michele. And then we're going to get a legislative update from Ashley Perkinson. And Ashley has been on top of things as the General Assembly gets started in earnest. Although I think they started and then they maybe even took off some for the snow day the other day, which is interesting. You know, us parents at home with kids learning online, we didn't get so much of a snow day. But glad that everybody is here and with us. And before we depart, we'll also offer a chance for announcements as well. So without any further ado, I would like to turn things over here to Michele Rivest with the North Carolina Early Education Coalition. Welcome, Michele.
Well, good morning, everyone, and thank you to NC Child for this opportunity to talk to you about the North Carolina Early Education Coalition's legislative agenda and what we're looking at for childcare this session. And I'd be remiss if I didn't start by saying, you know, this is a very collaborative agenda that we're putting forward. NC Child is a primary partner for us in this work, and we are working together through NC Child with a group of early childhood advocates to really put this agenda together and to push it forward this session. So thanks to you for all of what you do. I'm going to focus in on the childcare crisis and what we're hoping legislators will do to address this crisis right now. We are really urging them to provide additional resources to stabilize and sustain the child care and early care and education system, which has really been devastated by child care. If you have a child that had been attending childcare, the struggles that we're under right now. So back in March and April, when COVID started in our state, most of the childcare programs closed. They had no resources with which to continue to operate until we got the first federal CARES package. And that has been a lifesaver. It has really helped stabilize the field. Right now, we know that while most programs have reopened, and it was a very slow reopening through December, most have reopened, but all are operating at very high vacancy rates. And so without a full enrollment, they are not able to really sustain their programs. Early on, it was predicted that 1 out of 3 programs couldn't sustain major loss for more than 6 months. We know programs are closing still, even though there are more reopened now than closed. And the future doesn't look particularly bright for childcare, which, as we all know, is essential, right? It's essential not only for working parents and for their young children's development, but for our state's future economic recovery and certainly long-term prosperity. So we're calling on our legislature and policymakers to first start with the federal COVID childcare package, the next one. So we're anticipating that North Carolina could receive about $338 million in federal childcare relief alone. So with that, we have recognized that the first round was a good start. We're in a better position now than we were in April, May, June because of that. And we want to see the legislature and the Department and Division of Child Development continue to invest in 4 key strategies that we think are essential for really saving the childcare industry from further collapse and to put it on the road to long-term sustainability. Before COVID, those of us who work in this field, we knew the childcare system financing model was broken. It didn't work well before COVID. It certainly has been completely damaged by the COVID crisis. Costs are higher now than they've ever been. One study estimates childcare programs are experiencing a 47% increase in their costs. And that's due to all of the health and safety requirements, as well as social distancing, and this low enrollment, because without low enrollment, a full enrollment, they really can't sustain. So here's the 4 priorities in a nutshell for you. I'll just quickly go over them and then be glad to take questions if you have them. So the first one is to continue bonus pay or some type of hazard pay for childcare teachers and staff. All through the pandemic, childcare was considered essential, and certainly the childcare teachers themselves and staff were the essential workforce behind the workforce. The average wage for teachers in North Carolina is about $12 an hour, despite the fact that most hold at least an associate degree. 1 in 5 teachers has no health insurance, which is, just really a concern, especially during a pandemic. And almost 40% receive some form of public assistance. So we realize that the early childhood workforce itself has been devastated by the pandemic, including experiencing COVID crises themselves and in the classrooms. So what the state did last session with the COVID childcare relief money was to provide bonus payments for teachers and staff who are continuing to work in the field. And that was a very successful strategy because it actually just put more funds into their paychecks, which was desperately needed. And it served as a strategy to retain teachers, right? To keep them working in childcare. Long-term, we think we should transition from bonus payments and hazard pay, which I think is really a more apt term, to really looking at the structural problems with low wages for teachers and the fact that there are so few benefits for early educators. So that that is one of our top priorities. I would say it's probably our leading priorities. If we don't solve the workforce crisis, we really won't have a child care system because they are the key to a quality early education program. The next initiative is we would like to see the legislature and the state invest in emergency child care subsidy assistance for working families. As you well know, many families can't afford the cost of child care, which averages about $10,000 a year. That's as high as a year of college tuition in North Carolina. And many families remain on the child care subsidy waiting list, often for years. Right now, there are over 16,000 families on the waiting list. These are essential workers, and they are unable to return to work or maintain their employment without childcare. So we're urging policymakers to make some investments in these families. We did do it with COVID money in the first round, very short term, a couple of months. And we think this is time to begin to think about these families who are on the waiting list are maybe working, they're essential workers, and yet they can't afford the cost for childcare for their own children. A third priority for us is to add another round of operating grants for child care programs that are open. So as I mentioned, childcare costs have risen dramatically. Low enrollment means, they just can't make their budgets match. They are struggling to pay fixed operating costs, rent, mortgage, facility maintenance, all of those things continue whether you're open or not, frankly. And so we know that the state provided operating grants before to sort of fill the gap until programs are fully enrolled. And so we're urging the state to do another round of operating grants. We want them to be targeted this time to childcare programs who are serving low-income families who might be receiving subsidies because they really can't afford to serve these families. And so that leads us to our next priority. And this priority is to raise the childcare subsidy market rates to improve access for working families and to also help stabilize childcare programs. Now, this may be a little bit down in the weeds for most of you, unless you pay your childcare costs. But each county receives reimbursement for a parent who may be receiving childcare, who is receiving childcare subsidy based on a standard rate that the state calculates every 3 years. And these rates are woefully inadequate. They don't come close to meeting the cost of care. And when you look at the salaries and benefits or lack of that teachers are paid, you can see it right there. It doesn't at all cover the cost of quality childcare in our state. And so what we also know is that if you look across the state, counties don't have equitable rates, right? You could be serving a 1-year-old in Wake County and a 1-year-old in Hayward County, and your Hayward County rate would be $300, $400, $500 less than what that same child is being reimbursed for in Wake County. And of course, there are differences in the cost of services county to county, but they're not that dramatic, right? The basic costs of staffing, facility operations, those are pretty standardized costs across the state. So this proposal, I think, is very innovative. The Budget and Tax Center did a study and helped craft this, and it's to create a statewide average as the floor. So no county would receive less than the statewide average for that particular age group of child and that star rated system. So I know that's complex and it probably doesn't mean a lot to you unless you're a childcare program or a parent. But what we really want is to achieve some equity in the system, right? Because we know these are programs that are in low-income communities serving low-income families. And, disproportionately, these are families and communities of color. So it's time we address this in a more equitable way, not just across counties, but for the children and families they serve. So that is our overall COVID childcare package. Each one of these has a leg that could be continued. with permanent funding by the legislature. And so we want to build towards that as our strategy for future sustainability. We have a long way to go. It's going to take a very big, worthy wage campaign to get wages up. It's going to take great advocacy by parents and providers and those who are employers that benefit from child care subsidy assistance or child care assistance for working families. So we'll look forward to figuring out ways we can work with all of you in moving this forward. And so in the interest of time, I think I've taken up my 10 minutes. I'll sort of stop there and maybe look to see if there are questions in the chat that I can answer in whatever way works best for you, Adam and Fawn, in putting this session together.
Yeah, wonderful. I think Fawn may have been keeping her eyes on some of the questions that might have popped up. Thanks so much, Michele.
Oh, you're welcome.
I see a background question here for you, Michele. Could you repeat the percentage of childcare workers who don't have health coverage and who are on public assistance?
Yes, 1 out of 5 early educators do not have health insurance, and almost 40% reported that they received some form of public assistance in the last 3 years. So they are living in poverty.
And then a question from David Rockefeller. Are we talking about subsidies and financial assistance for privately owned childcare centers?
Sorry, my phone's ringing. Yes, childcare subsidies in our state go to any private childcare program who wants to participate in the childcare subsidy assistance program, who is operating at least a 3, 4, or 5-star level. So it does support families who are enrolled in private childcare programs.
Great. Any other questions, please feel free to type them into the chat. And I know we have some colleagues on the line from Budget and Tax Center. I think Logan is here. I think Michael is here from Smart Start. So just wanted to open that up to you guys too, if you have anything you want to share or weigh in with, because this is a big lift and a large community working on these issues.
Sorry, we can't hear you, Logan.
How about now? Turns out you have to unmute your computer and your phone if you're using phone audio. My name's Logan Harris. I'm a policy analyst at the Budget and Tax Center, and we've been working with NC Child and the Early Education Coalition on these policy recommendations, and in particular have done some analysis around the subsidy rate increases, which, as Michele acknowledged, is really kind of complex and in the weeds. So I'm happy to answer questions about it. I'll also just drop my email into the chat, and if anybody had questions about the details of what the Budget and Tax Center has worked on, would be happy to talk offline.
And I'll chime in for Smart Start. I'm Michael Welker. I'm the policy officer with NCPC and the Smart Start Network. And I think Michele did a great job walking through the key principles from our perspective in the network. I think we're really looking forward to working with the coalition on some workforce issues this session. And I think that what Michele laid out is just a great and holistic set of recommendations in general. So I can drop my email in the chat as well. I know we might have some Smart Start EDs on the call, but if you have other intersections with the Smart Start Network and want to think about that perspective on this work, please just get in touch.
Thanks, Michael.
Yeah, and I just wanted to say, I mean, it's been an amazing collaborative effort to get, so many organizations agreeing upon and moving this agenda forward. I think it's really going to take that. And, we've reached a new day. So not only is the COVID pandemic causing just new challenges, but I think it is also presenting us with, opportunities to really address some of the long-term crises and problematic issues with the childcare system. So I just want to thank everyone who's been part of this big effort. I do see a question from Abby Ware that I'll just speak to really quickly about, do we know how many families are on the subsidy waiting list who are essential workers? We don't know that information, Abby. What we do know is that many essential workers, in our state, essential workers is broadly defined, right? And so whether you're a frontline healthcare worker or a law enforcement, or any other maybe of those higher risk essential workers, they are not prioritized. And that isn't the way our state would go about it. So it'll be interesting to see if we develop some new policy to make sure subsidies first go to the most, I don't know how you prioritize one essential worker over another, but maybe those who have the greatest hardship and the least access to resources in some way. I hope we don't get down to prioritizing, but $338 million should go very far to addressing all 4 parts of our agenda. And that's what we want to keep moving, is all 4 parts.
Thank you.
I see another question for Michele or other folks. Logan might know this. The 40% of early childhood educators who are on some form of public assistance, do we have any county by county data on that?
Well, yes. And I don't know if it's specifically that, but thanks to Child Care Services Association, who does the workforce study in our states, they this year have put together a county by county fact sheet on the workforce. And so if that statistic exists on a county level, it's in there. So I'll look for their website link and put it in the chat for you. So yeah, it's an amazing profile of the workforce in every single county. So, and there we go. Marcia Baslow's on the call and just put that link there. So amazing work done by CCSA.
Thank you, Marcia. And I wondered if y'all wanted to speak at all to the Child Care Caucus that is getting started, or I think it's called the Early Education Caucus. Is that right? In the North Carolina General Assembly?
Yeah, I think it's actually called the Early Childhood Caucus, or maybe it's the Early Childhood Education Caucus. What I know is that it's being revived. Leadership is Representative Ashton Clemens and Representative Donna White. So I know it's started in the House, bipartisan leadership. It's really exciting to see this. And, you know, the plan is to have it also exist on the Senate side, but I don't know if leadership has been established for that. So if you have legislators in your own communities that you think could become or are interested in early childhood issues, Representative Clemens has asked that you refer them to her. So it's exciting to think that we might have a focus within the legislature to talk about these issues and all of what's on our collective agendas for kids and families.
I'll just add, we had the opportunity to speak with Representative Clemens yesterday afternoon, and I believe on the Senate side, it's going to be Jay Chaudhry from Raleigh and Jim Bergen from Harnett, who are going to be leading the effort on that side. So as of right now, it's an open invitation to all members. So we're going to see who ends up in that group moving forward.
Thanks, Michael. I'm really excited that this is such a bipartisan, bicameral, men and women leading these groups. Really excited to see that shaping up. All right, other questions? I just see lots of thank yous and appreciation for the early childhood advocates coming in the chat box. So thanks for those. I'm not seeing other questions. So I think we can probably wrap this section.
Okay, well, once again, everyone, I'm sure Michele is okay if you reach out to her as well, and Michael and Logan also mentioned that. So if you have any questions, follow up, please, be in touch and keep apprised of what the Early Education Coalition is up to, because these are super important items that we're all going to be need to advocate on. So thanks again, Michele. We appreciate it. And now moving forward to our next speaker, we have Ashley Perkinson with us, and Ashley is serving as NC Child's contract lobbyist, and she is going to provide an update about what's going on at the state and maybe a little bit at the federal level as well.
All right, thank you, Adam, and good morning, everyone. Thank you so much for Michelle for that terrific update. We are also very excited to work with the new leadership of the Early Childhood Caucus, and those subject matter caucuses provide such a great opportunity for legislators to come together in kind of an informal gathering and really dig deep into these policy issues. And so we're very thrilled that that has been established and look forward to working with those legislators and leadership of that caucus this session. So the legislature was back this session. They convened on Wednesday. And we, at this point, are up to 35 bills introduced in the House and 28 bills introduced in the Senate. They're still gathering, putting together committees. Just this week, Speaker Moore released the names of all the committee members. So remember last time when we spoke, we knew the names of the House committee chairs and the Senate committee chairs. Now we also know the full makeup of those committees. So all of those names are listed on the General Assembly website. You can go to ncleg.gov or .net and click on the committee of your choice if you're looking to see the full list of committees. And I believe on the House side, we're up to 42 committees. So there are a number of committees that will be working this session. So as I mentioned, several bills have been introduced. The legislature did not have a voting session this week. And it's my understanding the first of next week, the first couple of days also will not be voting sessions, but then they will start moving into voting sessions. We also received an update of what some of the first items of business will likely be. On the House side during session this week, it was mentioned that one of the first areas of focus will be more of a technical COVID bill. As you remember from the CARES Act, some of those early deadlines were, December of 2020, and then those got extended. So there's some technical tweaking the legislature needs to do to make sure those deadlines have been extended beyond those original deadlines. So we'll start out with a technical bill and then move into more of a substantive funding bill, likely based on the December legislation that passed Congress. And of course, President Biden has the new COVID relief package, the 1.9 trillion package that I'll be giving an update on here in just a few minutes. But that's also on the horizon. And if that gets passed, there will likely be additional legislative action that will need to take place. Also want to mention a couple of the bills that were introduced, just to give you an idea of what's been introduced so far. There was a hands-free bill introduced by Senator Bergen, Senator Corbin, and Senator Woodard to keep folks from texting while driving. See a lot of that on the road. There's also on the House side, Representative Everett introduced a bill to make $15 the minimum hourly amount for non-certified school employees. There are also some policy issues that have been discussed that we haven't seen bills yet introduced. One is for a summer school program. This is something that's been talked about through leadership, establishing a summer school program for children who are failing their grades and to provide that as a resource, but not a lot of details yet on what that funding could look like or what the structure would be. Also, as of yesterday, there were reports that the legislature may consider legislation that would require school districts to have in-person school, at least in some form. So that, again, is a policy issue that's being discussed. We have not seen the bill introduced yet. Did also want to mention on the state policy front this week, and this is shifting gears from the General Assembly to DHHS, but there was a really terrific, and I'll put the link in the chat
box. There was a really terrific webinar that DHHS put together this week on Medicaid transformation, which, as you all know, that we talked about with the standard plan going online in July of this year. This webinar provided some great resources. Secretary Cohen presented on the webinar along with Deputy Secretary Dave Richard and Assistant Secretary Jay Ludlam. So I think it's around an hour long, but it's a really informative webinar. So I'll shift gears now to the federal update, unless we have any burning questions on the state side. Okay, all right. So on the federal update front, President Biden has been busy with executive orders, and just in the last few days, President Biden signed an executive order to kind of restore some of the protections from the Affordable Cares Act that the Trump administration had backtracked on. President Biden's quote was, "There's nothing we are doing here other than restoring the Affordable Care Act and restoring Medicaid to the way it was before President Trump." Part of the kind of the main points to this particular executive order would be to reopen a special enrollment period from February 15th through May 15th. So that is part of that executive order package. We've seen other executive orders coming out of the President Biden's administration really from day one. But we wanted to mention this one specifically, of course, because it deals with the health policy that we are covering. As I mentioned earlier, on the horizon, we've got the $1.9 trillion COVID relief package that President Biden has put forward. Also, as of yesterday, there was news reports that Democrat leadership in the House and Senate, talking, of course, on the federal front, would like to see movement on this package as early as next week. There is also, discussions about in what form. Once, the thinking of is that it would have a very easy passage through the House, maybe a bit more difficult time on the Senate side. There are conversations, and this is something that Whitney pointed out during our last conversation, the option for reconciliation passage. And when you use that approach, you can't cover all the areas that the Biden package includes, but it could include some of the items, but it would have a lower voting threshold than just a regular substantive vote would have in going through the Senate. There's also been a lot of talk lately about the Senate filibuster and whether the filibuster's days are numbered. But it's been a really interesting time, hearing the discussions about just kind of the Senate process. The Senate tends to be the body that is traditionally focused more on consensus, although we haven't necessarily seen that the last few years. But that is, kind of the traditional Senate approach. So it will be fascinating to watch how President Biden's COVID package moves through the House and Senate. On the federal level, we don't have a definite timeline at this point, although, as I mentioned, we are hearing reports that Democrats would really like to go ahead and move this forward next week. So with that, I will pause and I'm happy to go over any of the particular aspects of President Biden's COVID relief package. I know Whitney went over some of the highlights last time. I'm happy to go over that again, or we could move on. So.
Thanks so much, Ashley. I do think we got one question that popped up, maybe.
Yeah, there's one from Lenora Smith. Is Medicaid transformation covering social determinants of health?
That's a great question. And, social determinants of health has been a focus area for the department. Secretary Cohen has talked a lot about social determinants of health. And I think it depends on specifically what aspect of those social determinants of health you are looking at, because there would not be just a broad, catch-all area, but some of those issues that can create health issues down the road, whether that be, nutrition and mental health and kind of that whole person approach. There's a lot of aspects to it. So I think it's looking at what particular area you're focused on to see if that particular area would be covered.
And I think Lenora was following up to ask mostly about housing. I think, yeah, go ahead, Ashley, I'll let you answer. And if there are other folks who want to pipe in, feel free.
That's something we can look at. It's my understanding typically Medicaid does not cover housing costs, but that's something that we can certainly look at in the context of transformation.
And just wanted to flag Camille from AmeriHealth Caritas is saying she's happy to talk to folks too if you want to send her an email about transformation. So thanks, Camille. Any other questions on state or federal policy issues for Ashley or any of our esteemed guests today? Happy to take those in the chat. I don't see any more right now, but thanks, Ashley, so much for that great summary.
Yes, thank you. And I think it's certainly going to be an interesting week on the federal level next week, it sounds like. So we will kind of see how things go. And speaking of, I don't have all the details at this point, but I was talking to our friends at the North Carolina Housing Coalition earlier this week, and we work a lot with them on various housing issues, and they were saying that there is some things that they would like to see happen in this federal package or some way federally that would go along with the CDC's extended eviction moratorium. That moratorium has been extended, and I think that there's discussion, obviously, about a lot of these issues in the federal package. So they are just looking at but unfortunately, what's happening is there's still a fair number of people who are being evicted from their homes for a variety of reasons. And so they want to look at kind of strengthening some of that. And we at NC Child are certainly supportive of what we can do to support families being able to stay in their homes and children staying in their homes. And during COVID, as we all know, it's become an increasing problem. And so keep an eye out, because the point of the story is that next week, I think we will be circulating a sign-on letter for organizations that will speak to some of these issues that we could then hopefully get some signatures on and send up to our federal delegation as they are thinking about all these various things. Do we have any other announcements that anyone would like to share?
Adam, I'm going to share a quick announcement or reminder really about our Voices for Children. Y'all probably hopefully know by now we're going to be giving our Tom V Advocacy Award to Cassandra Brooks, which is an awesome fit with today's focus on early childhood advocacy. But we are still taking nominations for the Community Voices Award. So this is for a grassroots organization in North Carolina that's advocating for kids and families. They're going to get a $2,500 prize and lots of attention. So if you have an organization you would like to nominate, you have until February 15th. The link is on that slide, and I'll pop it into the chat, or one of us will pop it into the chat box, and it'll be in the follow-up email. But just want to make sure that's on y'all's radar to nominate somebody, and sharing the website where you can get all the materials from this call afterwards. It will also be in the follow-up email. So thank you for indulging me, and happy to take other people's announcements.
Okay, well, if hearing none, the other thing I will just say also is if you all are having conversations with your elected leaders, your state legislators especially, and are willing to, share intelligence or information you get from those conversations, or need support fact sheets, other information, need support coordinating one of those type meetings at the local level. Of course, everything basically is happening virtually these days, but we would really like to be a part of that process. And we always think it's a good thing. The more information we can all know collectively around the priorities of legislators and what they're thinking helps us all hopefully be more successful in our advocacy efforts. So if there's nothing else, I would like to thank, oh yeah, go ahead, Lee.
I'm sorry, this isn't exactly an announcement, but, and I was late, so something may have been said about this, although I doubt it. I just want to put out there that there's a ton of research to support the notion that children who speak a language other than English, young children who speak a language other than English need to be continuing to learn their family's language, their home language. I feel like this is such a big ask when there's so many issues before us, but I think it's something we've got to start getting on the table. There's so many children who speak a language other than English at home, and somehow we've got to get to the point where our children can be continuing to be taught in that language in early childhood settings.
Mm.
So putting it out there, putting it out to the universe.
Thank you, Lee. Appreciate
Thanks,
that.
everybody.
Maybe it's a topic for discussion for another week.
Yeah.
And we can have that discussion in both Spanish and English, thanks to our interpreter. And the video for this call will be available in both languages after we hang up today, and we'll send that link out.
Thanks.
Okay, everyone, stay safe. Hope you have a wonderful weekend. Talk to you soon.